Welcome to the Recovery Therapist. Today we're going to talk a little bit about what maybe the first 7 days of recovery is going to look like. The plan is to look at the first 168-hour timeline and talk about what you can kind of expect during that period of time. We'll spend a little bit of time working through the withdrawals and then other ways that you can help manage some of that stuff. Arguably, the first 168 hours are probably the most physically and emotional confusing hours of your whole recovery life, if not your life in general. A lot of times you may feel sick, anxious, or even strangely euphoric, and we'll talk a little bit about how that happens. I've been a social worker for over 25 years, and I've got over 30 years of sobriety. So the video, we're going to break down what happens to your body and the brain. We're going to focus on days 1 through 7 and kind of what to expect so we can normalize what the process is. Because for some of us, this may be a totally new experience and we're not sure kind of what to expect as we walk through this process. To begin with, I want to talk about days 1 through 3. And this is the acute phase, or what I would call the detox flu phase. Now the textbooks, they're going to call it acute withdrawal syndrome. They list symptoms like tremors, anxiety, and insomnia. First, let's look about what's going on from the clinical perspective in the first 24 to 72 hours. Basically, your central nervous system is in shock. We call this autonomic hyperactivity. Remember, we talked in one of the previous videos about how your body has become accustomed to having alcohol in its system and has become a working part of its system. And essentially, we are now removing that from the body, and so the body's going to start to retaliate a little bit, for lack of a better term, because of what it's going through currently. Now, what we know is that alcohol is a suppressant. It essentially suppresses the central nervous system. Basically, your brain's been pushing on the gas pedal just so it could function. And then when we take away alcohol, the brakes are gone, but the gas pedal is still kind of floored. The body's continuing to try to get stuff flowing so we don't feel or we don't look impaired. And so that's what, when we talk about the gas pedal has been pushed to the floor, it's been pushed to the floor because the body's trying to make sure that we're safe. Clinically, this manifests in tremors, elevated pulse, diaphoresis, which is basically heavy sweating. So that's kind of the clinical definition. It's accurate, but it doesn't really capture kind of what we're feeling and kind of what we're going through as we feel our body kind of make some adjustments and some changes and stuff. Basically, we become uncomfortable. Quite frankly, my first week, I didn't really care too much about the autonomic hyperactivity. I just knew that I had tremors. My hands were shaking. Didn't feel real good, and I didn't necessarily know the exact reasons why. All I knew is that I just was very uncomfortable. I had tried multiple times when I was going through a period of relapse and getting sober, relapse and getting sober. So there were multiple times where I was trying to detox myself off the alcohol. The last time through, I did have some medically managed detox, which relieved some of the issues that were going on. So if you're sitting there right now and kind of going through some of this process, and I want you to hear me, you're not broken, you're not weak. That's just the shaking your body's going through, trying to find balance again. It is very uncomfortable, yes, but it's proof that the alcohol is leaving. So kind of the clinical insight side of it, of kind of what's going on with the brain, is we've got GABA receptors, which really aren't operating, and we've got glutamate spikes, which is kind of where all of that irritability and anxiety is coming from in the brain. The body is in panic because the alcohol is now gone. So let's talk about some clinical terms and then what the lived experience says about those clinical terms. As I mentioned earlier, the first term is automatic hyperactivity. What that feels like is you've had 10 cups of espresso and you haven't slept for days. Your hands are shaking, and for me, I was just vibrating, and it was quite uncomfortable. And what I talked about earlier was diaphoresis. Essentially, that's the cold and clammy sweats that you get at night. You may wake up soaking wet. I know that there's a smell from the toxins that are being released from your pores. I've had people comment numerous times back when I was drinking that even though I had taken a shower and started the day, I still smelled like alcohol. Next, we've got gastrointestinal distress. And essentially that's just nausea, some vomiting, you got zero appetite. I call this the floppy stomach, where I just don't want to eat anything and my stomach just feels like it's a mess. And lastly, we've got insomnia. And I think this one becomes kind of important. When we talk about withdrawals, typically they tend to be the opposite of whatever the effect of that substance is. And since alcohol is considered a suppressant and suppresses the central nervous system, the opposite's going to be that hyperactivity that we talked about. And so even though I'm really tired and want to sleep, I'm still struggling with sleep. My mind is racing. Everything is still kind of wide awake, but I am really tired, and it becomes very frustrating because I want to get some sleep, but for whatever reason, I can't seem to get my brain to shut down. So those are kind of the physical, when we look at the physical aspects of withdrawal within the body, usually the first 72 hours, those are some of the physical things that we're going to see. Generally, the physical is going to last, like I said, 72 hours. That being said, it can last longer depending on kind of what's going on with your body. For some people, maybe you have some liver damage, so it's taking a lot longer for the alcohol to process out of the body. So that becomes a challenge. And it may last a little bit longer than that. I do want to touch base on one of the important things when we talk about alcohol withdrawal. Depending on how much you drink and how often you've been drinking, we can have what's called the delirium tremens, or the DTs, what most people know. Early on in our drinking, our body really hasn't started to rot, for lack of a better term, and so our ability to detox isn't necessarily as compromised. But if we've been drinking over a long period of time and drinking higher quantities, typically that's when we start to see somebody be susceptible to the DTs. And the reason why this becomes important is because there are two substances when we talk about withdrawal that become dangerous, and one of them is alcohol and the other is benzodiazepines. Both of those are central nervous suppressants. So I want to talk a little bit about what those look like so you can seek medical attention. You need to be able to distinguish between what's being uncomfortable and what maybe is more of a medical emergency. And as a therapist, I need you to know the difference. If you're experiencing visual or auditory hallucinations, basically seeing things, hearing things that aren't there, or maybe you've had a seizure, these are the DTs. This is delirium tremens. And this is not a time for you to tough it out. This is really a call 911 moment. Get to the ER. Generally, the symptoms appear within 48 hours to 96 hours after your last drink. And so what we see on the mental side of DTs is intense confusion, severe disorientation, hallucinations, visual, auditory, and tactile is touching, extreme agitation, and fear. Through the physical side of it, we see heavy sweating, we get tremors of the extremity, so we got hands, feet, all of those kinds of things. We'll see a rapid heart rate, we see high blood pressure, fever, and sometimes seizures and stroke. That's why it becomes really important to seek medical attention at that point, because again, those become life-threatening. So if you're starting to see things that aren't in the room, spiders on the wall, shadows moving, or you're hearing voices that aren't there, again, let's not tough it out. You don't want to try to ride this out for the sake of your pride. If hallucinations start, that's your body telling you you need to get to the hospital. So you can call 911 or get to the ER. Again, you're worth saving. If you're shaking violently or the hallucinations, again, go to the ER. Alcohol withdrawal can be fatal. So we're going to move on to kind of the next section. This will include days 4 and 5, so we're really days 1 through 5 at this point. And we're moving from that physical component, and now we're really talking about the psychological, what's going on in the brain as we work through detox. Essentially, we're really looking at kind of that mental fog, the cognitive distortions, those kinds of things. The first thing we're going to talk about in clinical terms is psychomotor agitation. In lived experience, what we're really talking about here is it's just really hard to sit still. You're pacing around the house. You can't seem to get settled. You just feel like you're about ready to crawl out of your skin. The next is going to be anxiety or panic attacks. And again, the lived experience of this is there's this impending doom, this kind of free-floating anxiety that something's going to happen out there, even if you're safe. Again, you're always kind of looking, you think the next shoe's about ready to drop. The next is going to be brain fog or cognitive impairment. And this is where you can't even focus on a TV show. You can't really read. You're kind of pacing around the room. Your thoughts are a little sticky and slow. And the last thing we're going to talk about is irritability and mood swings. This is snapping at loved ones for breathing too loud, crying over a commercial. Your emotional skin is raw. You're having a difficult time regulate your emotions. They're exaggerated and not really consistent for how you usually operate. Last thing I want to touch on is a thing called anhedonia. And basically what anhedonia is we kind of have that lack of dopamine, where everything kind of feels gray or boring. There's just not a whole lot of enjoyment because, again, the dopamine has maybe been depleted and it's just hard to feel good. So it's a little rough in that early part of recovery. As we talked earlier about that psychomotor agitation and those cognitive impairments. So the brain chemistry is misfiring, right? The GABA receptors, which calm you down, they've been depleted. The glutamate, which excites your brain, it's surging. So that's the all gas. The imbalance creates this state of hyperarousal where you really can't focus. It's hard to sit still. This low-level sense of impending doom. So the opposite can happen as well, and that's what AA refers to as the pink cloud. In this instance, I've kind of gotten sober, it's early on, and everything just feels amazing. And that can be kind of a trap because we're mistaking this intense, temporary, euphoric feeling of happiness as what final recovery is going to be. And so if our expectation management is that, oh, this is easy, this won't be a problem, man, I got this beat, then life happens, because life always happens. And if we haven't started to establish some way to deal with coping strategies and deal with life on life's terms, this becomes a problem. We get frustrated and angry that recovery isn't this easy, and a lot of times that can lead to drinking. Another common pitfall is that after we have about 4 days of recovery, we're feeling pretty good, and the idea pops in our head, hey, I think I can have one drink. And as I explained in one of the previous videos, is once we've lost that control, we really can't go back and have just one. This voice will continue to kind of get louder unless we figure out some way to address it. You know, thinking back on mine, I spent like 6 months at one point where I was drinking daily. And to think that, 4 days of me being sober is going to be enough to negate that 6-month run that I was on. Again, that's just part of my denial system, and that's just kind of the foolishness that my brain tells me, my disease tells me, oh yeah, we can drink, it's not going to be a problem. Because remember, the goal of the addiction is to continue to use. These are the kinds of things we need to be aware of as we work through trying to challenge those thoughts that are coming from that old reptilian part of our brain. I will say that your brain's not broken, it's just rebooting. You need to show yourself a little bit of grace and be patient with some of the glitches that are going to happen. Eventually it'll work its way through, but it's a little rough those first 5 days. So I will say in this early part, it's important to make sure that you're staying hydrated. You want to drink a lot of water, try to flush that system out, and then get to a place of what is termed radical acceptance. Don't try to be real productive during this period, and just try to stay physically safe. When we talk about radical acceptance, that's just the total acceptance of really what's going on in the present moment. Don't want to be judgmental, don't want to be resistant, don't want to attempt to fight it. Just kind of acknowledge that the pain's real. This is what's going on. There is a loss, and it's just very uncomfortable, but be okay with that. If I don't figure out some way to find some acceptance of this, I'll continue to have some emotional suffering and some bitterness towards me trying to stay in recovery. So generally, day 6 and 7, when we get to, by the end of day 7, most likely the alcohol is out of your system, unless again you've had some physical stuff that your body's been compromised. So, generally that's kind of clear. I will say on the back end of that, we just need to be aware of some of the stuff that's going on with our sleep. REM sleep is the process that our body goes through in order to do the repair work and make sure everything gets stored in the proper place. It's also the space where we do a lot of our dreaming. Because it's affected by alcohol, we don't have as much REM sleep, if any, while we're drinking. When we finally get sober and we haven't been drinking, a lot of times the body will throw itself into some heavy REM rebound. And if we were to set up some electrodes on your brain and take a look at what's going on, you would just see a bunch of firing that's just going crazy because your brain's finally going, hey, we haven't been able to do this for a while. We got a lot of catching up to do. Let's get started. And so there's a lot of firing going on. So what that means to you is typically we see a lot of vivid dreams, crazy dreams. I know working in residential treatment, people would come to me and I'm like, oh man, I'm having these crazy dreams. What do they mean? What's it about? And I would just say, it means that you're exactly where you need to be, right? You're okay. This is just you trying to catch up on your REM. And then kind of looking back, if I could compare myself from day 1 to day 7, the inflammation in my face had decreased. My eyes were clearer. And that's kind of what I see in my clients as well, is once they've kind of gotten onto that sober place, they have that inflammation, they look much better, their face isn't as bloated. So I want to talk a little bit about some survival tools that we can use in the first week that maybe helps us get through some of this stuff. I'm going to begin with sugar and let you know that at this point sugar may be your friend. That's okay. Alcohol has a boatload of sugar in it. And so when we stop drinking, our body continues to crave sugar. Some people put hard candies in their pocket. So when they have those cravings for sugar, they can just kind of pop one of those in their mouth, and that seems to satiate that craving. I know when I was working in residential, we would go through somebody's dietary history and would have a conversation about how much sugar's in alcohol, and that there may be an uptick in the desire for sugar. And they would always come back with, well, I'm not a big sweets person. I don't really like sweets. And it's like, well, yeah, because you've been drinking so much. And usually about 3 or 4 days later, they'd be standing over at the freezer pounding some ice cream. And they're like, I don't know why I want this so much. And we would have another conversation that would talk about, remember when we were doing the assessment, we had that conversation about this. And they were like, oh, yeah. Don't be surprised if sugar cravings kind of hit you in that early part of recovery. The other thing I would say is, look to change your environment. If there was a certain place you came home and drank in, don't go to that place. Go somewhere else. If it was the living room that I used to drink, go hang out outside or maybe go back into the bedroom. Change your route home. If you used to drive by the beer store, the liquor store on the way home, change that route up so you're not driving by that. Chances are you may be getting home quicker because you're not having to go out of your way to get to the liquor store. But change that route up. So we're not going into that consistent pattern. So one of the things that I did in early recovery is I had a 3x5 card. I put 3 kind of the nastiest consequences I could come up with from my drinking. It would be a reminder whenever those cravings came in that I would pull that card out and I would read through those consequences and say, yes, I could drink, but this is what's going to go on. Usually what I found is whenever I thought about drinking, it always seemed to be this, what I would call euphoric recall, where I always thought about the happy times. And those were usually that impulsive right here, right now. It wasn't later on down the road. So when I thought about it, it was like, oh yeah, I could feel that quick little buzz. That would be awesome. But I never got to the point where I drank so much that I passed out, or that I said stuff that I feel ashamed of saying. The 3x5 card, what it would do is when I had that urge, I would read through those and then I would say, okay, this is my reality. Here's what's really going to happen. If I choose to drink, these things are a possibility, and do I really want to do that? And what it did is it shifted from that impulsive right here, right now call, where I always thought about the happy time. And those were usually that it wasn't later on down the road. So when I thought about it, it was like, oh yeah, I could feel that quick little buzz. That would be awesome. But I never got to the point where I drank so much that I passed out, or that I said stuff that I feel ashamed of saying. The 3x5 card, what it would do is when I had that urge, I would read through those and then I would say, okay, this is my reality. Here's what's really going to happen. If I choose to drink, these things are a possibility, and do I really want to do that? And what it did is it shifted from that impulsive right here, right now reward, and it would force me to look at kind of the long term. What would the long-term consequences be? And so then when I would look at those long-term consequences, they weren't really worth getting that drink. So a lot of times those cravings, they don't last forever. They may feel like they're going to, but they will eventually diminish. And what I found is by doing that card piece, I started to associate my drinking with the negatives that occurred in my life. And all of a sudden that voice didn't seem to be so loud, and that voice didn't seem to have so much control. And it got a little bit quieter, and it became a little bit easier to deal with. And as the months and years kind of progressed, it really has quieted down. Still have it, still there, but I'm able to manage it, and I don't really give it much credence. Clinically, we know that acute withdrawal is a finite psychological process, which basically means eventually it's going to come to an end. Now, it may not feel like it when we're in the midst of it, but eventually it will. The GABA receptors, they will upregulate is the term for that, and the glutamate will stabilize. The shaking will stop. And the science guarantees that if you don't pick up a drink, your body will start to heal itself. But what I know as a man who sat kind of exactly where you're sitting, that science didn't seem to help me at 3 a.m. in the morning when I couldn't sleep and and my bed sheets were soaked from sweat. And I couldn't stop those racing thoughts. So my encouragement to you is if you're in some of those moments, I don't want you to think about the forever. I don't want you to think about next month or even next week. What I would challenge you to do is just stay in the day. What does it look like staying in the moment? And what we know is in the moment we're sober. And that is something. Although the voice may tell you, oh, that's not a big deal, anybody can do that. That's not true. So again, give yourself some grace, and also show yourself some appreciation that you've been able to stay sober for this period. It's not an easy task. It's simple, but it's not easy. But if you can do that, if you can just survive today, you're really doing the impossible. You are rewiring your brain 1 second at a time. The textbook says it takes 72 hours for the worst to pass. But I promise you this, from the view from the other side, it's worth every single second of the climb. I still believe that my worst day sober is better than my best day drunk. So if you're watching this and you're on day 2, keep going. Day 7 is worth it. So if you pass day 7, what was the one symptom that surprised you the most? Tell me in the comments to help maybe somebody who's just now starting this process. Now that we've survived week 1, next video we'll talk a little bit about what that first month looks like. There's a thing called post-acute withdrawal, and we'll talk about what that kind of looks like for you. I do appreciate you all being here. Be safe. We'll see you in the next video.